with our personal health. Holistic healthcare practitioners have a unique opportunity to help this transformation unfold. One of the ways we can do this is by providing educational opportunities so that we can make informed choices about our healthcare options. This is one of the reasons why I have chosen to provide this opportunity here today. This evening, we will be discussing the connection of the mind-body and take an in-depth look at how the brain and gut are connected and what that means to our health. You see, one of the greatest lessons I have learned through my personal healing journey, training, and working with my clients is this: how we feel from head to toe is determined by the health of our gut. Our speaker this evening is a doctor of chiropractic and nutritional health care. He received his advanced training in nutrition and is board certified in clinical nutrition. His practice includes genetic testing, advanced blood work, nutritional counseling, and biofeedback therapy. He is a well-known educational speaker and has presented on numerous health and clinical nutrition topics around the country and in Canada. For those of you who may have had the opportunity to work with him or hear him speak, you are aware that he is extremely knowledgeable, passionate about his work, compassionate, and sometimes even a little bit funny. We are grateful for the opportunity to have him here with us this evening. Would you please help me give a warm welcome to Dr. Gary Johnson.
Well, thanks, Michelle. I'll pay you later for that. I'm going to give you a little bit of an idea of what is going to transpire this evening, so you have an idea. What we're going to do is we're going to go through about 40-some slides, not a lot. And the purpose of the slides are not necessarily for you to take notes on, because they're more for me, really, as a guideline. So what I'm going to be doing, because as a lot of us know, you see some terms out there, it's like, what the heck does that mean? So what I'm going to do is when the terms pop up, I'm going to explain them in layman's terms so you understand what the whole thing is all about. Okay? Michelle told you a little bit about myself. I started as a chiropractor in Duluth in 1980, and since then I've really gotten into some advanced stuff. This obviously is going to be a very interesting topic, and the one thing that I'm going to say is this is very informal. So therefore, if I'm going along and something that I say you don't quite understand or you have a question, I don't have any problem with somebody at that time just raising their hand and stopping me and asking, because sometimes what the heck was I going to ask him? So I'll probably talk for about an hour or so, just to give you an idea, and then we're going to open up for questions, because I have a pretty good suspicion that I'm going to create a lot of questions here. So let's get started. The gut-brain relationship. The intestinal tract and what is going on in the gut has such a tremendous effect on the rest of the body, and it's interesting because a lot of people don't realize that. They don't think about that. If you correct what's going on in the intestinal tract, you're going to have a positive effect on a lot of things, and we're going to relate a lot of that to the mind, the brain, that type of thing, the gut-brain relationship. So let's talk about, first of all, some psychological conditions out there. Okay, anxiety. 6.8% of the population in the United States, 15 million people. Panic disorders, 6 million. Specific phobias, 19 million. OCD, 2.2 million. Major depressive disorders, 16 million. A lot of people with psychological issues out there. Well, when you go to your doctor, how is that treated? It's treated from the head above, right? Well, we're going to talk about some other things that you can do where you can have a very positive effect on a lot of these types of conditions, because there is a major gut tie-in with a lot of these types of things, and especially in kids, but adults also. Now, here's some of the terms. People get a little bit confused, so I want to explain a little bit of this. Part of your brain something called the hippocampus. The hippocampus is part of the brain that encodes for threatening events into your memory. So it's a piece of the brain there. Now what's interesting about that is this part of the brain that encodes for your memory is actually smaller in people who are victims of child abuse or have served in the military combat. So when you hear about post-traumatic stress, why would nature do that? It's a protective mechanism is what it is. According to the National Institute of Mental Health, emotional memories stored in the central part of the amygdala, which is another part of the brain, plays a part of the brain which plays a role in anxiety disorders, which we already talked about on the first page, and involve very distinct fears. So this is part of the brain that's really tied in with emotions. Can you have an effect on your emotions is what we're going to be talking about and how that ties in with the intestinal tract. And here's one of the slides. This is a fact. Chronic gut inflammation leads to activation of areas in the brain associated with mental health and behavioral disorders, including the hypothalamus, amygdala, and the cortical centers. Now, the hypothalamus is a very old part of your brain, and what the hypothalamus, one of the main things it does is it has a tremendous effect on endocrine or hormonal situation. So if you think about that, that's going to, anything from weight management, obesity, anything that's tied in with endocrine or hormones. Then you've got the amygdala, gut inflammation we were already talking about. It's going to tie in with your emotions. It's going to have a positive or negative effect with emotion. And then cortical centers. How many times have you heard this from people? I'm very cloudy-minded or very foggy-headed. A lot of that is tied in with the intestinal tract. So cortical centers is where most of the thinking happens. 97% of chronic fatigue syndrome patients report neurophysical disturbances like cognitive dysfunction, sleep disturbances, headaches, emotion-related symptoms. Did you know that depression is now being put in a category of an autoimmune condition? So is osteoporosis. And we're going to talk about some other conditions that are tied in with that, but as long as I brought that up, autoimmune, when you hear of the immune system, which we're going to be tying in here quite a bit, when I ask that question of people, you know, where is your immune system? Well, it takes up a large, lot of different organs in the body, your thymus, your liver, but in my opinion, about 80 to 85% of your immune system is in the intestinal tract. And a lot of people don't realize that. So when you hear of things like neurotransmitters like serotonin, you know, you hear of serotonin, what do you associate that with? It's usually the happy mood neurotransmitter. And then you ask professionals, well, where's serotonin made? Most people are going to tell you it's in the brain. Actually, about 80–85% of it is made in the intestinal tract. So, the happy neurotransmitter, where would you focus? Intestinal tract, of course. And the sheet that you've got there, as we go along here, you're going to see how I'm tying in some of these things, but I just wanted for you to have that so you didn't have to write a lot of those things down. Of the emotionally related, 40% patients report symptoms that are often part of anxiety and depressive disorders, including dizziness, appetite changes, and shortness of breath. So this is talking about the people with chronic fatigue. They've got all these other symptoms too. Now, here's the problem where a lot of professionals are scratching their head. A lot of times a patient will come into the office with a set of symptoms. Or there might be one missing. It's very difficult in this age when you're working with a patient, because I always use this comparison. It's like putting together a puzzle of the United States. You have to figure out what's Rhode Island and what is Texas. In other words, what's the biggest piece of the puzzle? Is it the intestinal tract? Is it maybe an emotional issue? Is it as a result of not sleeping so well? And those of you that have heard me talk before, usually I start out with my lectures like this, with 5 fingers. Really, if you think about it, it's a pretty simple concept. Health, really. What are you eating? Are you exercising? What kind of exercise are you doing? Do you have stress? How well are you sleeping? And are you getting sunlight? Those 5 things. Now I know what some people are thinking. Gary said sunlight. How about this skin cancer thing? I'm not going to go into too much depth there, but here's what I'm going to tell you. The sun does not cause skin cancer. It's going to add to a skin cancer situation, and most of it has to do with what people are eating. And let's just make this kind of simple. When the sun hits your skin, what is produced is a pre-cholesterol molecule. Now, is cholesterol, is that a fat? Is that a protein, or is that a carbohydrate? It's a fat. Therefore, if you are eating inflammatory types of fats, like vegetable oils, those types of things, which is what most people eat because they taste better, what's going to happen when that sun hits your skin? So, backing up a step, if people are eating junk, yeah, you should be staying out of the sun. You're going to run into a problem. But it has nothing to do with the sun. It has to do with the types of fats, mainly with what you're eating. Now, genes, you're going to hear genetic testing. You're going to hear more about those types of things. How do genes play a role in the development of autoimmune and the effects of environmental factors such as pollution, physical and psychological stress, and diet? When you eat something, when you exercise, when you sleep, when you get sunlight, when you're stressed, that all sends a message to the genes that are in your system. So the old thing used to be, well, I've got this genetic deficiency in the family, you know, I'm doomed, because everybody in my family died when I was 40. You might have that genetic weakness, but it's actually what you do to the gene. And what I mean by that is if you do something positive to the gene, you're going to have a positive effect. If you do something negative, you're going to have a negative effect. Because when you send a message to a gene, proteins are produced, and that's what happens metabolically in the body. So you got to send the right message. I alluded to exercise. Such a big deal. We're really finding now that a lot of professionals out there are actually considering muscles as an organ, because it actually makes something called cytokines, and they're called mitokines. And what they do is, if you're exercising correctly, it sends an anti-inflammatory message to the rest of the system. People don't think about stuff like that. And you're going to hear more about this. Resistance type exercise is actually very anti-cancer. Good stuff. What is the number one thing that will control your blood sugar faster than anything else? Better than what you're eating, better than medication. It's resistance type of exercise. So it is a big deal. So what kind of message are you sending to the genes?
Could you give some examples of resistance exercise?
Okay, her question was just some examples of resistance exercise. Very simple, something, let's say you're going to tie one of these rubber type things to a doorknob, and you're going to do some type of resistance exercise. Is walking resistance? No. How about working on a Stairmaster or walking up and down steps? Yes. So resistance means something where you're working against. Now, here's the problem with that. You know, and I watch people, because I'm in the gym 6 days a week, and I watch people on these machines. Actually, most people, you know, it's social hour in the gym. It's not really being in the gym. But anyway, when you do something resistance-wise, when you're doing something like that, it should be 1,001, 1,002, 1,003, 1,004. Not just pulling that band back and forth. Okay? Because the resistance is you're letting it resist. 4 seconds one direction, 4 seconds the other direction. Do you have to necessarily be in there lifting weights? Not necessarily. How about a quadriplegic? Can a quadriplegic do resistance exercises? Sure they can. They can do facial type things. So you got to be a little creative. But if, Suzanne, to answer your question, if you look up on the internet just resistance exercise, you'll find all kinds of them. But that just gives you a little bit of an idea. All right, here we go. Studies show that intestinal bacteria may communicate with the central nervous system by way of vagal sensory nerve fibers and the peripheral immune system. If you caught on what this means, there is actually communication with the flora or the correct bacteria in the intestinal tract, it communicates with the rest of the body through the nervous system. There are studies that actually demonstrate that. And you don't think about something like that. The other thing you got to think about is you really have to pay attention to what nature does. And what I mean by that is this. If you ask somebody how many cells do you have in your body, depending on, there's somewhere between 60 and 90 trillion cells. Quite a few. Did you know that the number of flora or bacteria in the intestinal tract outnumber the number of cells in your body anywhere from 10 to 100 to 1? Why would nature do that? Pretty important stuff. Okay? So creating the right type of environment internally in that intestinal tract is so very critical because it's going to have such a positive effect on so many things that are out there. Here's a study. The process of inflammation in the intestinal tract can be arrested if the interplay between the genes, the autoimmune, and the environmental triggers prevented by reestablishing intestinal bacteria function. So what this is saying, again, is exactly what I said earlier. What kind of message are you sending to the genes? Because the message that you send to the gene, that's the type of function that is going to happen throughout your system, in your body. So this, but on the flip side of that, here's what people think. Well, I'm not going to exercise, I'm going to eat junk, but I'm going to pour in a lot of these probiotics and that's going to fix everything. It won't work very long. It's a whole lifestyle change. This is a start in the right direction. This is a critical slide, and I want to make this slide very clear. Because I'm always asked the question, even from professionals, because you hear this phrase, it's like, what does that mean? And what I'm talking about is leaky gut syndrome. What does that mean? All right. If you can think in your intestinal tract, you have little fingers that are like little villi, and one of the phrases you hear a lot is, it's like shag carpeting. So you want that shag carpeting going on in the intestinal tract as opposed to flat tile that you might see on the floor. Okay? Because when you have that shag carpeting, that's where you have proper absorption of nutrient. Now, this particular slide, if you look here, this round thing you see here is actually a cell in the intestinal tract. All right? And you see the little villi here, which is the shag carpeting that I was talking about. So this is in the intestinal tract. Now you'll notice something. There's a gap here. You see this gap? That should not be there. This is what we call because you're going to hear this phrase come up later on, a tight cell junction. You've got little fibers that hold these cells together. Now the purpose of that is this. When you absorb nutrient, the way you absorb nutrient is down the middle of the cell, not in between the cells. When the nutrients absorbed through the cell, what happens is it is processed correctly the way nature needed it to be processed. When it's processed correctly, it gets into the bloodstream, and your body, nature, recognizes something as self. But here's what happens. When you're eating the wrong types of things, you're not exercising, when there's stress involved, you're not getting sunlight, everything that I was talking about, what happens is you're going to get a junction here that's split. Now you see these little green things, or they're little particles, I know you're way in the back, but what's happening here is these little green things can be food, they can be bacteria, they can be environmental pollutants, whatever it is, it doesn't matter. What is happening here is it is not being processed through the cell. Here's the bloodstream. It's going directly into the bloodstream without being processed. Now when nature sees that, what nature's going to do is it thinks it's something foreign, right? So what it's going to do is it's going to form antibodies against the antigens. And now you've got that memory in the immune system. And I always get this question, Gary, you know, with time I developed these allergies. Can I get rid of them? No, you can't. Why not? Because the memory's there. Can you quiet things down so that you don't have any symptoms? It's possible. So generally, once you created this situation, it's hard to totally fix, but you can just about get rid of all the symptoms. What we're going to be talking about today is how do you fix this? That's what we're going to be talking about, but this is a critical slide here. So just like it says there, increased intestinal permeability is an early biological change that often precedes the onset of autoimmune diseases. Okay, autoimmune means that your immune system is attacking itself. If your immune system attacks the pancreas, what do you got? You have type 1 diabetes. If the immune system attacks the myelin sheath of the nerves, what do you have? You have MS. And I already told you, depression is now being put in the category of autoimmune. So is osteoporosis. So is ALS. A lot of these neurological muscular dystrophy, they're actually being put in that category now, tied in with this whole intestinal relationship. Abnormal intestinal permeability can result in increased exposure of gut-derived antigens, exactly what I just got done saying, to the immune system and specifically to the liver. So what's happening now is this stuff is getting into the bloodstream. What's trying to filter it out? The liver's trying to filter it out. So, and I get these questions all the time. Gary, geez, I don't drink any alcohol. My doctor said I've got a liver problem. Why is that? Right here. Because it's mainly a digestive issue and the liver's trying to pick up the slack, something it was not designed to do. Oop. Okay, here are some of the conditions that are associated with intestinal permeability. Okay, these are autoimmune types of conditions. Type 1 diabetes, pancreas, rheumatoid arthritis, joints, celiac disease. Speaking of that, celiac disease in Crohn's has increased tenfold over the last 10 years. Tenfold. What's different in the last 10 years? Anybody hear of genetically modified food? Psoriasis, skin, Hashimoto's, thyroid, chronic fatigue, again, brain fog, migraines. Migraine headaches are now being put in the autoimmune category. MS, we already talked about that. Now, I'm going to clarify this. Toxins in the outer shell of gram-negative bacteria called lipopolysaccharides. LPS means the outside shell of bacteria that you are not supposed to have in your intestinal tract. That's what LPS is. So when you see me start talking about LPS, I'm going to clarify again as we go along, and we're talking about bacteria that was not broken down correctly and it leaked through that intestinal, between those two cells, and it's in the bloodstream. And it's floating all over the place, creating problems. They are one of the gut-derived antigens that trigger the immune system. So once you get these gram-negative bacteria that aren't supposed to be in there, the body realizes that it's something that's not supposed to be there. It's going to produce antibodies against the antigen. You've got an inflammatory situation going on. Where we run into a problem is you'll see there, lipopolysaccharides, lipo means fat. So what's going to happen is when these LPSs or these bacteria that are not supposed to be floating around in your system, if they deposit in certain areas in your brain, in your joints, in your tissue, wherever it is, the body's going to produce antibodies against that antigen. It's going to attack that area, and it's going to create a lot of these autoimmune types of conditions that we're talking about here. Two of the biggies out there. LPS, which we already talked about, these gram-negative bacteria and gluten will increase the release of inflammatory chemicals. We already talked about that. All right. This is similar to the slide that I showed you earlier, but this is on more of a smaller scale. So when you look at this here, here's these villi, or the shag, that's in the intestinal tract. You see these little cells here that I showed you earlier on a larger scale, and that's where the leaking takes place. So you see with time, it says here, pre-infiltrative, and then with time you see all these little things that are not broken down correctly. That's why it takes some time to develop a problem down the line. And I already alluded to gluten. I read something very interesting that genetically there's nobody out there that is able to break down gluten. But what percentage of people actually have a gluten issue? A very small percentage. But it's becoming even more so. I already alluded to the whole, the increase tenfold in the last 10 years with a lot of this Crohn's and celiac type of thing. But here, damage to the gut epithelium results in the release of microbes into the bloodstream, which I already talked about, these LPS, these microbes, and it correlates with immune activation, so the immune system jumps into play here. Okay, there's cells in the liver, which I already talked about, that's going to try to neutralize this toxicity. Now, here's something that's very interesting. You'll see on the bottom there it says, the cells in the liver are going to try to neutralize this toxic activity of this gram-negative bacteria and eventually excrete it into the bile. Okay, let's talk about this just for a second. You know of anybody out there that has gallbladder problems? You hear about it a lot. Okay? What does the gallbladder do? The gallbladder actually is a storage tank for bile, which is used to break down fats. All right, so where is it made? It's made in the liver. Okay, if you've got a lot of this gram-negative bacteria or stuff that's not supposed to be there, and it's excreted with the bile, but it's sitting in the gallbladder, is that going to irritate the gallbladder? Probably. Now, I'm not saying that that's a reason why we have so many gallbladder issues. What I'm saying is, I think it's potentially something that is adding to the problem. What you're eating, and again, tied in with bad digestion is what I'm getting at. Yes.
Jerry, if you don't have a gallbladder, where's the bile go?
Okay, if you didn't hear a question, the question was if you don't have if you don't have a gallbladder, where does the bile go? Where does it go? It gets dumped right into the stomach. Okay? Now, generally what happens, and I'm glad you brought that up, generally what happens is when it gets dumped in, it's going to be an irritant down the line. And it's usually about 2 years down the line. Now, if you've got a diseased gallbladder, you've got to have it out. I mean, plain and simple, all right? But if you've had your gallbladder removed, you should be taking some type of a fat digestive aid with every meal. And what I recommend people do is they should be taking ox bile with every meal, or some type of a something to help break down fats. Because if you don't, that bile is going to irritate the heck out of the stomach, and it's going to happen every time. Yeah.
When you say diseased gallbladder, you're not talking about just gallstones.
No, I'm not talking about just gallstones. You know, there's it's actually progressed to the point where it's degenerative, and you're not going to reverse that. And you know, sometimes you get people that are walking around with gangrene in their gallbladder. You got to have it out of there. You got to get that out of there. But then just be aware you're going to have to take something the rest of your life. Otherwise, you're going to have digestive issues. Okay, toxins in the outer cell of this bacteria, those LPSs we were talking about, may induce autoimmunity by a mechanism called molecular mimicry. What does that mean? What that molecular mimicry means is these bacteria get on receptor sites, or they get on in different areas in the body, and the body can't tell which is the bacteria or which is its own cells. So what it's going to do is it's going to attack itself, and that's where you run into a lot of these autoimmune types of conditions. Okay, and here you go. These bacteria have these sites in nerve tissue where they attach and look like the antigen. Therefore, the body produces antibodies against these sites. So, here, you've got a little piece of bacteria here. But you see these little things on the outside of the bacteria. What this is the immune system sticking little poles on there. And what happens is you see in different tissues, you don't see any of these little things, but you see them sticking out here. So what the body's going to do is once those are there, it's going to attack these things. And what happens is you get this whole immune system problem going on, and there's inflammation. When you have inflammation here, that's when you're going to get destruction of the area, whether it be the, in the brain, whether it be the nerve tissue, wherever it may be, intestinal tract, wherever, the joints, arthritis. And then we've got these terms we stick on all this stuff. And I get a kick out of that because people will call me on the phone. Gary, I've got this condition. Okay, big deal. What do you do about it? Well, there's nothing you can do about it. Yeah, there's a lot of things you can do about it. That's what we're talking about. Therefore, once antibodies are formed, various tissues can be targeted with chronic inflammation, exactly what I was talking about. The antibodies of wheat and milk can cross-react with these sites in the nerve tissue that look similar. So these are the two biggies, wheat and dairy. As you get over the age of 2, you start lacking a lot of lactase, which is needed to break down dairy. And if you don't have that, you're going to run into a problem. As a matter of fact, there's a study done out there called the China study, the largest study ever done on a human population. What is the major contributor to all types of cancers? Now, I didn't say the major cause. I said the major contributor to all types of cancers and all types of degenerative types of diseases out there. Number one contributor is cow's milk. And there's so much controversy out there now with grains. Well, you see wheat tied in here. Were we really designed genetically to eat grains? In my opinion, no. People that eliminate grains makes a big difference. And now we've got a bigger issue because now you've got genetically modified grains, so it becomes a bigger mess. Let's talk about curcumin, or one of the things you have on your sheet. The lowest incidence of Alzheimer's in the world is in India. And there's a big difference. And why is that? What do they eat there that a lot of? Curry. Okay? So they're getting a lot of cuminoids, which is curcumin. And where does curcumin come from? It comes from turmeric. And a lot of people will utilize turmeric as a spice, which is a good idea, but here's the problem. The active ingredient in turmeric is curcumin. The problem is the curcumin is wrapped up in the fiber, and when you consume the turmeric, you're not getting a lot of the curcumin out of it. As a matter of fact, most of the research says that you're lucky if you get 2% of the curcumin. That's why you're seeing, you can actually buy curcumin. Now, the thing you need to know about curcumin is there is a big array of quality. And I'm not going to get into, who's got the best out there. That's not the purpose of this. You've got to do your own little research. But the point is, curcumin, very anti-inflammatory throughout the whole body, throughout the whole system. Very good for assisting in healing in the intestinal tract. Curcumin has been shown to play a major role in chronic illness due to inflammation. Okay? Diseases of inflammation that are considered now in the autoimmune category. Alzheimer's is considered an autoimmune condition. And if you go back, there's a lot of studies now that are showing quality curcumin is actually reversing plaquing in the brain with Alzheimer's people, but you have to get a quality product. And it actually is being demonstrated. So it's going to be very interesting within the next year to 2 years if you see a big change with contribution of curcumin for Alzheimer's people. Parkinson's now has been put in the autoimmune category. MS, we've talked about that. Epilepsy, well, here's your psychological conditions again. Cerebral injury, cardiovascular disease, cancer, allergies, asthma, bronchitis, colitis, rheumatoid arthritis, renal ischemia, psoriasis, diabetes, obesity. Why obesity? We already talked about the hypothalamus and how the disruption of the whole endocrine system saw you looking at an obesity situation. Yeah, Susan.
Do we have a pretty good curcumin product?
What's that?
Do we have a pretty good curcumin product?
Well, I don't want to get into people, the better ones out there.
Are there some other ones out there?
Yeah, there are. There's a lot of other ones out there. Depression, fatigue, and AIDS. Probiotics. Okay? Probiotics have been shown to influence removal of environmental toxins from the intestinal tract. Very good supplementation. But again, here's what people do. Well, I'll take the probiotics, but I'm going to continue to eat junk. It's not going to work. It's going to work for maybe 4 to 6 months, and then it's not going to work anymore. So probiotics are a good idea supplementation-wise, but you can actually create that environment if you're eating good quality fermented type of vegetables. So, you know, everybody thinks that Gary's the big vitamin guy. That's not really true. It really goes back to 5 things. You know, what are you eating? Are you eating quality food? Is there a difference between organic and stuff that you buy packaged in the grocery store? Big difference. But probiotics. Now, what are probiotics? There's prebiotics, which you have on your sheet, and probiotics. Probiotics are the actual natural flora that is in the intestinal tract. Well, I'm just going to eat yogurt, Gary. Okay. Problem is when that yogurt hits the stomach, what's the pH of your stomach? Very acid, right? Probiotics are very vulnerable to pH changes. Therefore, what you're seeing now is you're paying for these probiotics that have a very good delivery system, and they're actually released in the intestinal tract where they're going to do the most good. How many different strains of probiotics are there out there? The authorities are saying between 400 and 600 different strains. So, a lot of different strains. So you want a combination of different types of things. Prebiotics are what feed the probiotics, and we're going to talk a little bit about this actually on the sheet you've got there. The toxic bacteria, or that outer shell of that bacteria, again, which is that fat layer, can induce inflammation and increase the enzyme that breaks down tryptophan. Now, why did I put that slide up there? I'm going to tell you a little story. I have a friend in Minneapolis. She's 56 years old. When she was 2, she was on very heavy dosages of antibiotics. As a result of that, she actually was blind for a month when she was 2. Terrible constipation issue. Okay? Within the last 2 years now, she can't sleep. Why not? She's got an intestinal problem. Okay? Because there's an enzyme, because of her whole intestinal issue, that's breaking down tryptophan. She's not able to sleep very well. Does she have some leaning toward depression and those types of things also? Absolutely. Tryptophan comes from food, which is converted to 5-HTP, which is converted to serotonin, the happy neurotransmitter again, which is converted to melatonin for sleep. So if you're breaking down tryptophan, or you get the enzyme